call to order the February 3rd, 2026 Planning and Oversight Committee meeting. We have roll call, please.
Mr. Brown.
Present.
Mr. Albright.
Here.
Mr. Arnold.
Here.
Ms. Banks. Ms. Bell.
Present.
Ms. Carter. Ms. Crockett. Dr. Elhai. Here. Ms. Friedman. Reverend Gordon.
Here.
Ms. Harding.
Here.
Ms. Howe.
Here.
Mr. Lambert.
Here.
Ms. Mendoza Locke.
Here.
Mr. Ortley.
Here.
Ms. Rodriguez.
Here.
Mr. Salas.
Here.
And Major White. Here.
Thank you. Recognition of visitors, please.
Faith Keller, board staff. Stephen Elton Sanchez, board staff.
Jonathan Slaughter, board staff.
Annie Minton, CJCC. Tina Mason, board staff. Jennifer Beer, board staff.
Thank you. All righty, has everyone had a chance to review the minutes for the January 6th, 2026 Planning and Oversight Committee meeting? Can I have a motion to approve?
Second.
Properly moved and second. Any questions? Those in favor?
Aye.
Against? Any abstentions? Motion passed. All right, moving right along with this agenda. Item 5, we have treasurer's report. Amy is going to be doing that report for us.
Good afternoon. I'm going to start on page 6, statement of revenue and expenditures. In December, we saw an overall decrease in net assets of just over $1 million. Total fiscal year-to-date revenue through December is $16.47 million, or approximately 3% below budget. The largest variances are in federal revenue, which is lower than expected due to the timing of the SALS 4.0 grant funding. Miscellaneous revenue, which is higher than expected due to the timing of the daily state construction reimbursement. We'll talk about that in a couple. Both variances are temporary revenue, reflecting differences between fiscal years. Total year-to-date expenditures are $13.03 million and remain under budget across most categories. With overall spending at 88% of the fiscal year-to-date budget, the largest variance continues to be within purchase of service expenses, where we saw increased expenditures for December, but remains under budget overall. Balance sheet on page 7. As of December 31st, 2000, to $20 million in summer. This decrease was primarily driven by a $1.39 million reduction in cash, partially offset by $170,000 increase in accounts receivable. Total liabilities decreased by $126,000, largely due to the reduction in deferred revenue recognized during December. The non-designated fund balance decreased by just over $1 million, ending December at $17.93 million. Payment details can be found on pages 8 through 10, and there's a motion for your inventory on the bottom of the slide.
Your motion to approve?
So moved.
Second.
Questions? Those in favor?
Aye.
Those against? Any abstentions? Motion passed. All right, health officer designation. Elijah.
All right, if you'll turn to page 11, we moved the health officer designation up on the agenda. you'll see here, we have 3 new candidates and 1 renewal. We, as always, the advisory group met, reviewed applications, and are recommending that we do applicants and renewal for certification as a health officer. And you'll see the motion in the page 11.
I'll motion.
Second,
Second.
question? Those in favor?
Aye.
Opposed? Abstentions? Motion passes.
Right, moving on to the Recovery House and Residence for Young Adults. This is a supplement grant from the Ohio Department of Behavioral Health. They created an opportunity using underspent SOS funding, the state opioid stimulus response grant, to provide service, to target a specific population of 18 to 24-year-olds in recovery houses. This funding, we're being recommended for ZEP, who will provide some subsidy for about 14 young adults and more comprehensive services for that population. So this grant runs through the end of September 2026, well, September 29th, 2026, and it's using, the state's using some of the federal funding using that for this opportunity. It was a pretty quick turnaround. We got notice of the opportunity. We had I think in 2 weeks we had to submit something. So ZEP probably might be able to serve more in this time, but we wanted to give a conservative number that they're pretty sure to hit with the short time frame we have. And so you'll see a motion towards the bottom of page 11 with the $100,000 from the Ohio Department of Behavioral Health SOS funds for this particular project.
So moved.
Second,
Second.
any questions? Those in favor?
Aye.
Against? Any abstentions? Motion passes. Elijah,
All right, moving on to St. Paul's Community Shelter Support Funding. As you know, we provide funding to St. Paul's for their shelter and their winter crisis program. Don't need to explain to you all the importance of the shelter and the winter crisis program, especially in the cold temperatures now. Last year, they served 271 individuals in that winter crisis program. And we've been talking with them about, how to keep this sustainable. There were concerns at the beginning, prior to the fiscal year starting, but St. Paul's has been diligent in, searching for funding to try to support this particular part of the winter crisis, the shelter operations, the winter crisis program. So we had set aside in some funding through our recovery support block grant to potentially go to St. Paul's for that. So this is money we have set aside, it's unallocated. So today we're just recommending to increase their allocation by $30,000 to support their shelter operations and winter crisis program. And you'll see that motion there in about the middle of page 12.
your motion to approve? Second,
Second.
any questions on it? Those in favor?
Aye.
Those against? Any abstentions? Motion passes. Moving on to item 9, and Elijah again.
Okay, so here we'll talk about our recommendations for 120-day notices. Just for some context, Ohio Revised Code and within our contract requires that if we're going to make a substantial change in contract, meaning the primary elements of the contract or reducing an allocation or eliminating an allocation, we need to provide a 120-day notice. And then after that, agencies have a chance to appeal that, and there's a process for that. So we do this annually. Last year, we were a little bit more aggressive with those as we were trying to, get in a better financial position as, you know, we had, the deficit spending. So this year, you know, after looking at some, underspending, some program outcomes and just where we are financially, and changes to Ohio revised code around that 120-day notice piece. We're gonna give a full list of recommendations. We're thinking about how to make this simple without going through each page item by item. So, to be very clear, every agency that receives a provider agreement will get a 120-day notice. That is for changes around the language of the Ohio Revised Code that is taking the 120-day notice process as we know it, reducing it to a 60-day process to make changes to contracts or end contracts and have a less rigorous appeal process. So that'll go into the next year's provider agreement. Also, we are adding language to be able to change programming or funding based on federal or state requirements. So you are probably aware, a few weeks ago, SAMHSA one day said, we're not gonna fund all this. And agencies scrambled to figure out what to do, and then they decided to refund it. Well, if money passes through us, we need to be able to kind of quickly act, and this language will provide the opportunity so we can readily change contracts as requirements and funding changes that are outside of our control. So every agency will be getting a notice that reflects that. Now, there's some agencies that will get another notice, which we'll go over, and then some agencies that have more substantial notices. So I'm gonna read the list of all the agencies that will get a notice pertaining to those 2 bullet points related to contract changes. So those agencies include ABLE, the Belief Center, Big Brothers and Big Sisters of Northwest Ohio, Center Hope, the Learning Club of Toledo, Mercy St. Vincent's, NAMI Greater Toledo, St. Paul's Community Center, Sophia Figueroa Arts and Cultural Center, Swanton Area Community Coalition, and the Thomas M. Warren Center. Again, those notices will just be around the contract language that is the 120-day notice to align with Ohio Revised Code, and then the ability to change programs or funding based on federal or state requirements. Are there any questions about that? Because that was a lot of agencies I just listed out there.
I have a question. So this is just language that was changed per organization for 2027. And is it something revisited every year, or this is a permanent language change?
We present and we will present revised contract language change as an agenda item at our board meeting on the 17th. So you'll get an opportunity to see that language. It's just with the agenda today and being so full, we didn't want to rush the contract into it as well. But our contract typically reflects Ohio Revised Code language. So it would be a permanent change unless Ohio Revised Code language changes in the future.
So in addition to that list of agencies, there's a few agencies that have a purchase of service allocation. And there will be another point in the contract changes that is aligned with what we've been talking about in the strategic plan as we move towards the benefit package. So we're looking at doing something minor this fiscal year, potentially aligning with changes that Buckeye's implemented or something else. But we're working towards that. So the agencies that receive a purchase of service allocation will have that additional point in addition to the other ones that you've heard. So those Those include Family Child Abuse Prevention Center, New Concepts, and Ohio Guidestone. So those are kind of the big general ones that we're talking about here. And now I'd like to go through some that have a more robust changes. And you can follow along here. So if you go to bottom of page 13, Harbor, you'll see the contract language changes, including the language about a benefit package. But we're also recommending to reduce the funding for the Individual Placement Services Program, or IPS for short. This program, while it does fantastic, it has had a history of underspending for the last 3 fiscal years. So we're just recommending a reduction of their allocation to more reflect what they're spending. And then if you move on to page 15, neighborhood properties, you'll see the proposed changes in the provider agreement are just around the 120-day notice language and the language about revising programs or funding. In addition, we're recommending to make some changes to the adult care facility program. There has been some inconsistent financial and programming reporting that we're trying to understand better, whether they're overspent or underspent, or where are they with this. We've been working with them for the last few years to move people to residential state supplement to help pay for group homes, which has radically transformed like our allocation. So we anticipated some savings there. We're still trying to figure that out. I will say that people are being housed in group homes. So the mechanics of the program are working. We're just trying to figure out how it's working financially. So we're recommending a 120-day notice based on those inconsistencies, so we could have a formal conversation about the program. Moving on to page 16, the Sylvania Prevention Alliance. Again, you'll see those contract language changes in the provider agreement around 120-day notices and language to revise programming or funding. In addition, we're recommending not to renew the drug take-back day funding for fiscal year 27. So drug take-back day is a national effort that's really led by the Drug Enforcement Agency. They're responsible for doing that, and our funding has traditionally been spent just for kind of advertising billboards. So given the environment we're in and the budget adjustments we need to make, this seems like a program we can take off of our roster and really allow the DEA to kind of do what they need to do with that. Task of Northwest Ohio, you'll at the bottom of page 16, you'll see the language around 120-day notice and the language for revising program or funding. In addition, we're recommending not to renew the Community Transition Program, only because this is funded by the Ohio Department of Behavioral Health, and we're unsure of its future next fiscal year. So you will probably remember this from last year and the year before and the year before. This is one of those programs that we give a 120-day notice just because we're not positive if the state is going to refund it next year. So if they do that, then we'll bring that back to the board. UMADOP of Lucas County, that's kind of in the middle of page 17. You'll see the 3 points with the provider agreement around 120-day notices, revising the language for programming and funding, and the alignment with the benefit package. In addition, we're recommending not to renew the Safe Neighborhood Project for fiscal year 27. We've had a lot of discussions with them. We've provided support, but we're getting we're getting non-compliance with reporting requirements, and this has been a trend for the last several years. So, we're because of that, we're recommending both financial and programmatic reporting. So we're recommending not to renew that funding, and then we're recommending a reduction in the purchase of service allocation. Their current allocation is 85, thousand. We're recommending a reduction of 7,000 because they've not billed us yet and they're not in a new billing system. So, no. So we're not entirely sure why that is yet. I know before Michelle had retired, she had worked with them to try to get them up and running. They're just not up and running yet. We have a historical, we have a history of them not really utilizing that purchase of service allocation. And for a number of years, we reduced it year by year by year until it was a minimal amount. So we're recommending kind of to go back to that. And we can revisit if they start billing and stuff. Unison Health, that'll start at the bottom, page 17 to 18. You'll see the recommendations for the provider agreement. And you'll notice in this, they receive a purchase of service allocation, so they'll receive the benefit package fully. In addition, we're recommending not to renew the funding for the recovery housing program. So about a year and a half ago, we had suspended programming because they weren't aligned with current Ohio Revised Code requirements to be certified by Ohio Recovery Housing. During that time, they remained operational and were successfully operating without our funding. So not as punishment to them, but we, as we're looking at how do we get in a better financial position, this seemed to make sense if they're able to operate outside of our funding. And then intend not to renew the data informed prevention programming. So Unison for a number of years has been doing programming around a lot of advertising, commercials, some billboards, social media stuff. We began working with them last year to focus more on kind of specific programming and strategies that align with a strategic prevention framework. So within that, there's some required core strategies that you have to be doing to effectively do prevention. And we break some of this funding with Ohio Mass funding, which requires some of those primary prevention strategies, either education or environmental strategies. So I'm getting some glazed looks, so I'll just say they're not aligned with the best practices around those prevention strategies. So we're recommending not to renew that program. And then finally, ZEP Center, similar to Unison, they get that purchase of service allocation. So you'll see that bullet point there in addition to the other two. In addition, we're recommending that we need to make some substantial changes to the mobile crisis and call center to align with the Ohio Department of Behavioral Health adult mobile crisis and the utilization of 90 days. So we're not recommending to take money to reduce their allocation, but as an opportunity is presented from the state that Scott's led, that is a regional approach, how that looks like we're still working it out and what that'll mean for us. But we needed to include that so we can make those changes for next fiscal year. And then finally, recommending not to renew the problem gambling prevention and treatment for fiscal year 27. Again, this is a program that's funded directly, not directly, but it's funded by the Ohio Department of Behavioral Health. So until we have an allocation from them for next fiscal year, we're not sure on the status of how we'll fund it or how we'll fund it. So that if they do fund it and amount, we'll bring that back to the board. But this is one of the other ones you see year after year. So know the status of it for the next fiscal year. And then page 19, 20, and 21 are the motions followed by a draft letter for each of the agencies.
When you go back over, you said something about 85 and reduced it to 70, and then you said they were non-compliant. Is that what you just said?
So for their financial and programmatic reporting, they've had a history of just not meeting the reporting requirements that are outlined in the contract. There's so much that staff is spending a lot of time chasing them down, trying to get it from them to the center, doing all this formal time And then the purchase of service allocation, that reduction is primarily driven by they haven't spent any of the money that we've allocated, and they've not set up the mechanism to spend the money. So it's not like they're billing and they're like in limbo, or like we have a backlog of bills. They haven't set up the system to be able to bill yet. So going back to our previous allocation for them, because you'll remember after our 120 days of discussion last year, they wanted to focus more on treatment, so they asked us to increase their allocation to 85,000 from either 10 or 15,000. So they specifically said they wanted to focus on treatment, and then we're here and we haven't received a bill yet for that. So with that, all these notices have an appeal process, and we encourage agencies to appeal because we want to have a good conversation with them and negotiate, how we can best move forward. But these are our recommendations at this time.
Can you help me understand, with Unison, with the recovery housing program, we're pulling back funding because they did a really good job handling it while they weren't certified. How are they doing it when they weren't certified? Help me understand that.
So they had recovery housing before the requirement. And then when they fully realized this requirement, that change in Ohio Revised Code, they started the application process. So they maintained their recovery housing during that process. They collect, subsidies from clients to help with that, and I think that's how they kind of maintain it. I will say though that we've received money through the state, Ohio Department of Development, to help pay for recovery houses too. So as grants like that come up, we can consider that from them. This allocation is specific to our local funds that we're recommending not to renew next fiscal year. Any additional ones would be just opportunities that are made available to us.
Can we start back now?
Yes.
I just want to ask the question, especially for those that are newer, just so they know. The staff has already been in communication, and this is not going to be surprising. Correct?
We have attempted to communicate with a number of them. It may be surprising for some of them,
Okay.
but that's why we do encourage them to encourage everyone to appeal. So we will meet with everyone and negotiate. This is based on a number of conversations that our internal team has started back in September.
Okay.
As we're looking at finances, programs, and where we are financially.
Thank you.
You've been really working really hard. This is a lot of information here that you've provided us and that you've changed and made some, went in different directions. So I applaud you for that. I mean, there's a lot here. And I think it's a lot to understand that. I think this is the first time we've had that many 120 notices.
Yeah, there's a lot going on, I mean, with the
Right, so there's a
environment.
lot going on, so I really applaud you for getting this done. Thank you.
Thanks for breaking it down for us.
And this is a staff-driven process. Elijah led, it was encompassed all the departments having conversations, sitting down, saying, okay, let's look at the reporting, let's look at the funding, let's look at the outcomes. One of the things that we've discussed in the past is we present you these outcome reports semi-annually, and you see time after time deficiency, 23, 24, 25, and you invariably ask the question, what are we doing about this?
Correct.
Right? So then that conversation gets detached from this conversation because it happened months ago. And this is the ramifications of underspending, non-compliance, not meeting evidence-based strategies. And sometimes you can be doing everything right, but as we start to read the tea leaves and see that priorities are likely going to need to shift, and funding is going to have to start to follow that, we start to prepare the board for being able to do that. So this is, you know, the second or third step. If you recall, we cut nearly $1 million out of our budget last year. So I haven't done the math on this, perhaps you guys had, about where we're at.
Yeah, so total, we're looking at about 700,000, but that includes some specific funding from the department for specific projects. With this, we're looking at about 400,000 of local funds.
And as you're aware, we will negotiate, we will sit down. As Elijah mentioned, the process, the 120-day notice process law has changed. House Bill 138 is actually is enacted in the middle of our appeals process. So the bill actually starts on April 1st. Well, we have to give the 120-day notice on before March 1st. And then in the middle, you know, within 30 days, the law actually changes.
Okay. And
So
that's just the awkwardness and timing.
it's awkward, of course, but our contract language is still our contract language. So our intent is to follow our contract language, which requires a face-to-face conversation with the agency. And then if they request, they can have a board-to-board meeting, which we do in a public meeting. And let me take the opportunity to remind you that a 120-day notice process works both ways. So an agency can say to us, we don't want to provide this service in this way anymore. We're going to give you a 120-day notice process. What will be different about this year is about halfway through, the Ohio Moss portion of their potential interaction with any mediation is eliminated. So they have no more, as of April 1st, they will have no more input into our local funding decisions. So they won't be able to say, we want you to mediate, we want you to do this, as they were in the past. The other thing is all the language around negotiation that has created conflict locally and around the state is eliminated. So we already have draft language for the contract that our state association developed. You'll see that at the next meeting. But the work here is, I don't know, maybe second or third step in an 8-step process. And I think it's very consistent with what has been said by the trustees, both during our meetings discussions and our outcomes discussions, and also leading into our strategic planning and development of that. So.
In our usual fashion of being transparent with our service providers and agencies, I would encourage that we remind them of what the appeals process is going to look like, to the extent that any of it is new because of the change in the law halfway, and it would be new to them, just so everybody's on the same page with how it's going to work.
I think that's very fair. We normally would do that. I would usually just send an email out, because we send the letters out via email and then usually a hard copy. And normally with my email, I'll have a language, we encourage you to appeal. Here's what's going to be different about it this year. Our process will stay the same. It's the state's process that is changing. And then we'll change the contract language to reflect the new process for next fiscal year.
So did I understand correctly that the law changes within our typical cycle? So there is a portion when it comes to if everything fails and we don't come to agreement before the opportunity to seek input from the state, that process with the mediate, how the recommendation regarding mediation is gonna shift, so I guess that's really what
Yeah.
I'm focused on to
Mhm.
highlight for them, those things that we do.
And since I've been here, I think we've had two agency programs request state involvement in our local decisions, and the state has declined both of those. So,
So it's really kind of no change.
yeah, it is kind of no change, but that doesn't mean that we wanna just ignore the current contract language. Now, if the state wants to ignore that, that's not on us.
To what extent do these changes keep pace with our past experience?
If I'm understanding your question correctly, the contractual language changes will make it easier for the board to be proactive and react if need be, if something happens in the middle of a contract year.
Because we anticipate.
Right, and also, part of the law change is something that we wholeheartedly support. It applies a transition period. So if we decide either in the middle of the contract or to not renew a contract, the law now requires that we provide 60-day transition funding based on the previous contract language for the services that we're proposing be eliminated.
So which means that even though 120-day notice we negotiate, in some cases, it's not likely that there'll be much negotiation because we're acting out of necessity.
Correct. And as always, the board has always had the final say. So, but as experience would show us, most of the appeals are negotiated and resolved amicably with our provider network. There is a rare instance where we haven't been able to resolve those conflicts. And honestly, I think that it's because we are communicating with them. We're over communicating in many cases. We might have fallen a little short with this 120-day notice process just because of the timing of just everything that went on. But we can make that up, right? This went out on Friday. I know Elijah made a few calls. I made a few calls. So not every provider understood that they might be taking what cut. But there is always ample opportunity for them to call and state their case, and then we ask for something in writing that says, okay, tell us why we're wrong. And we would expect and encourage them to do just that.
So that, what you just described going out Friday is not these letters. These won't go out until after our board meeting?
No, but this is in the packet, so everybody receives the packet. So everybody's seen the draft letters. So, but these letters will not be sent until final approval, which is,
I understand,
yeah.
but what went out on Friday?
This packet went out on Friday. So, right.
I have another question.
Yes.
Do the changes in the statute affect the ability to make fiscal changes with agencies during the contract period?
Yes. And that's the same 60 days with an additional 60-day transition period. So if we wanted to make something in the middle of the contract year, we'd have to give them a 60-day notice and provide them 60-day transitional. And there is language that requires us to establish a due process for that.
So, but beyond procedural, which I understand, are there any guidelines, any limits, any evaluation process that we have to go through to say we can't fund this anymore?
No. Okay. It's all on us.
These agencies know what you're talking about when you say they have to develop a behavioral health benefit package.
So it will be we don't have all the details yet. That's part
So
of
if they get a notice they're supposed to do this, they still don't know how to do it.
they won't be doing anything. It's just what they'll be allowed to do. So we've been talking with them for a while now, because as you'll remember, POS expenses have hit, over budget. And with the projected loss of Medicaid expansion, we're expecting more people to come into the system. So how do we ensure that we can still help a good number of people with the funding we have?
And let's also remember that there are already several managed care entities that have implemented benefit limits. So that's why we felt the need to kind of interject it into this contract, because somewhere midstream, we're gonna have to say, we need to shift over to this. And as you see in our strategic plan, that is a core component of what we'll be considering. The other thing is we need the ability to evaluate, while our contractual language would dictate that you can't move somebody from Medicaid to board funding, that, we'll need to be able to continue to evaluate if that is occurring, how that might occur, and maybe people slow their enrollments down on Medicaid so that they can take advantage of this or that funding. So there's a lot of moving pieces to this that will have to be considered.
In regard to the 60-day notice and the 60 days of transitional funding, when is the first day of the 60 days of transitional funding begin to run? Is it after the 60 days, or does it overlap the 60-day notice?
So contractual language, the draft contractual language that was written by our state association representative, I haven't read it in total yet, but my guess is that it would not be, how would I say it? It's probably, I don't believe that it would be a fair process to run it, what's the word, concurrent with the evaluation or the appeal due process.
Okay, so it may, in all actuality, result in 120 days, 60 days notice, and 60 days transitional funding.
Provided you're serving clients. So there might be programs that we give 60-day notice to that might not need the 60-day transition because they're not serving clients.
Okay, all right.
Okay, I get it now.
Yeah.
That makes more sense.
All right, is there a motion to approve? Any further questions?
Are we taking them all at once? Together?
We can, but would you
Yeah, I
prefer
think
we pull out task? Yes, we can pull the task motion out separately, so
All
why
righty.
don't you do the,
Did we move
we already
on?
had a motion for the whole thing, so.
So he has to rescind.
Okay. Okay, so they excluded task, now you. can-
Okay, so the new motion is to consider all excluding task.
Correct,
Second,
it was already.
already second, very good. Any further questions? Those in favor?
Aye.
Against? Abstaining?
Yes, now do task.
All right, then now we have a single motion to consider the motion for task. Second? Any further questions on that? Those in favor? Against? Any abstentions?
Abstain.
All righty, motion passes. Thank you. All righty, we're moving on to item 10. This will be Scott, information about Danny's place.
Thank you, Elijah, for that. I guess that's carrying the water for quite a while on this meeting. It's not an easy thing to do, so appreciate all the work from you and all your staff. All the staff, I guess. But let me draw your attention to the top of page 47. What we're attempting to do is move from a startup phase to a startup operational phase. Right now, we're providing Unison $400,000 for startup of Danny's Place. That was from the period of July 1 of 25 through October of 31st of 25, and then we extended it in November through February of 26. Over that time, they have their management team in place. They've received their required certifications, which was no easy feat to do. It required multiple, working with multiple overlapping entities. That's all in place. They have actually had their two management team on site there, readying the facility for operations for some time. However, the drag on creating an operational agreement is that our region was counting on Department of Behavioral Health funds to help solidify support across the 10 board regions. And if you recall, it used to be 11 board regions. Now it's 10 because Huron is actually in the process of joining Seneca, Sandusky, Ottawa, and Wyandotte board. So I'll be referencing 10 boards from now on in our region, still 23 counties. There are varying disagreements on the funding model across the boards and the preference of Unison to have a grant-funded model for the first year. Meaning you could either fund it grant, meaning we give you 1/12 a month, or we can pay you per bed day, a per diem of about $400 a day, or we could do some kind of hybrid. Unison prefers grant for the first year. There are boards in our region that prefer per diem. I'm trying to negotiate all of that and get people on the same agreement for a couple of reasons. One, it's time to get this operational. But two, we've been carrying the load of funding Danny's Place when it is a regional project, and it's time to shift that to the region. In preparation for that, board staff is recommending an allocation which would be 15 months allocation to carry us through the entire fiscal year 27. That is lower than what we currently have in our financial forecast. In fiscal year 26, we had a financial forecast for Danny's Place startup and operations of $750,000. In fiscal year 27, we had $1 million forecasted. We're proposing that we take essentially, I'm doing the math in my head, but we want $1.2 million of that remaining amount to be allocated for operating Danny's Place for the period of March 1st, 2026 through June 30th, 2027. I purposely phrased the motion to give us some flexibility in how we fund Danny's Place locally here, because I'm trying to negotiate a 10-board contract. So we'll all sign the same contract with Unison and the 10 boards at the same time. So we need some flexibility. Maybe it ends up being a hybrid of we pay half the money in a 12 grant, in a grant basis and the other half per diem. It's just math. We can figure all that out, but we got to get something on the table first. Unison has indicated that if they have a contract in place for operations by March 1st, they can begin the process of hiring their operations staff and be close to taking, if not taking referrals, essentially June 1st. But we got to get the contract operations first. So that's where we're at. I have drafted the contract. I am meeting with my peers at the end of this week to talk about their preferences and trying to get everybody on the same page. And then we will meet with Unison on the 13th in person at Danny's Place, all 10 board directors to negotiate out all of the particulars of the operations contract. So
Is the expectation that the $275,000 that's being pulled out will be made up by the other 10 boards?
So there's an expectation that the other 9 boards fund the gap for all, not just the 275, because the 275 was an estimate. Now we have a better understanding of what the budget will look like and what the per diem cost will be at a certain ratio of occupancy. That when the forecast was created, it was just that, a forecast. We think we're gonna need this. So now we have a better understanding, so we're comfortable. Plus, we're looking at prioritization of populations and services. We may need that 275 somewhere else. Now, my guess is that this population is gonna be identified fairly high on that prioritization, but I don't wanna make those assumptions without going through that process. So that's why we're at it. Simply making room for the other 9 boards to invest what we need them to invest. And by the way, maybe create a little space for Department of Behavioral Health to give us a little more funding. We were able to secure $125,000 in regional crisis funds that for Danny's Place, that was used for Danny's Place. We don't know if we're gonna get those funds again or not.
So ultimately, are we negotiating with the other 9 boards this $1.2 million as well, or is that this board?
This is just ours. So what we've done is we've created a matrix of who's at the state hospital, what our capacity is, what Lucas County residents are at the state hospital, what percentage of that is, what percentage of those folks will likely end up in Danny's Place, and what that cost is. That 1.2 million represents that cost. I've done that for each board in the area based, and granted, since we have no experience, because this is a new program, a new service, we are making some assumptions. One of the things that we learned along the way is that when people around the region where people exit the state hospital, they actually go back to the county jail. That doesn't happen in Lucas County to the extent that it happens elsewhere. So we had to account for that. Now my guess is once sheriffs understand that there's a place other than the jail that they could go back to, that we might see those numbers go up. But the plan is to designate a certain number of bed days for each of the 10 board areas and then budget accordingly to those 10 beds or those days.
So you have budgeted potentially. What happens if you find you need to make adjustments? You need to go back and make changes.
Well, that's Unison's concern. And that's why they want a grant payment, because within the current contract discussions, there is boards approve pre-authorization for them to go in. Then we have a commitment to pay up to 30 days with a pre-authorization process for the next 30 days. So we control the front door and the back door while they have all the costs sitting at their, at their feet. So they don't want to be left holding the short end of the stick, which I entirely agree. But we have to have a balance there. So if we find that we're using more bed days and we are over budget over the period, then we may come back to you and say, okay, we might want to ask for additional funds, assuming they're in the budget. What we're just as likely to find is other communities may want to have additional bed days and look at underutilization and go, okay, hey, I want to capture some more bed days. However, once a bed day is gone, you can't make it up, right? Because once the day's gone and that bed's empty, you can't make that up. unless you budget on a capacity rate of under 100%, right? So that drives the cost up. Integrating in all this, not to confuse it even more, is the potential for them to bill Medicaid and then take that off the top. We don't know what that experience will look like until it happens, but we're negotiating that into the conversation as well. Funding model for the Medicaid reimbursement has radically changed because managed care entities implemented benefit limits. Some of those limits will impact what Unison can do. So we're kind of, it's a jigsaw puzzle at this point in time. And I may have overstated I may have over-explained, but I wanted you to understand the complexities of what we're trying to get to.
Will there be any allocation, formal or informal, among the different boards, the number of beds available? Will there be
Yes,
beds?
that has already started.
For Lucas County, for Ottawa, whatever.
So that has already started. Other boards are requesting their boards make allocations. We know of at least one right now that have already done that. And I'm encouraging them to do the same flexibility. Not say per diem or not say this, just let's negotiate out amongst board
I'm
directors.
not talking about a financial allocation, a bed allocation. In other words, will Lucas County be assigned 8 beds that will always be available for Lucas County, for example?
It will be a percentage of beds, so it won't be a solid 8 bed. Well, I guess you could calculate it that way if you want. We'll have a number of bed days, and that's the plan. And we plan to budget based on those eight beds, for instance. 8 times 365 divided by, or times 90%, and that will give you a dollar amount that we can say, okay, that's what we need. Yes, ma'am.
So you got all these other counties out there, who decides who gets a bed first?
Well, that will be a good problem to have once it's full, all right? So,
So we're paying all this money starting in March, but they're not gonna take a bed in June?
well, we've been paying all this money for, starting before March, we've been paying it since. So we gotta keep the doors open. First of all, there's expenses related to the facility that we're carrying regardless of if Unison is involved or not. And utilities, but also building management. Unison is performing building management services as well. They have people on site. If we say, no, we're gonna wait till June, which I would not recommend, then we gotta go hire a building manager. And then we also have to then transfer all of the utilities back in our name and then reinstate our insurance. So that is not a good option to consider at this point in time. This is a regional project. I mean, here's the alternative, and let's just be transparent. Here's the alternative. Say, we're not gonna do anything until everybody else does something, which probably doesn't get us any closer to operations, or give the facility back to the state and say, you can figure it out. That seems a little dramatic.
I'm like, no, no, I don't think
This would have
so.
been all simplified if we would have gotten money from the state that we believed was coming. Now, they never promised us an amount, I wanna be fair. But they made a pretty big point that say that we're gonna fund these 26 crisis projects around the state. By the way, we're all in the same boat. And it would have been simplified because we would have had the seed money to get the experience, to tell us what we actually needed to do. Now we gotta do it with our money. All board money, not just our local.
They said that right there.
Thankfully, we have it in our budget forecast. Other boards may not have had it, so may not have it so easily.
All righty, so we have a motion. Second?
Second.
Any further questions? Those in favor?
Aye.
Opposed? Abstention? Motion passed. Very good. 8th, annual report.
You gotta turn that on.
Good afternoon. Oh, okay. Good afternoon, trustees and guests. Oh, okay. Oh, okay, okay. So as we've heard today, a lot of things in our community and just the world right now, it feels uncertain. And we know that with uncertainty, sometimes that can come across as fear and other things in the community. So with this annual report, I wanted to touch on what we were doing and have it serve not just as what it's required by ORC to identify our programs, our financials, and demographics, but to also serve as an anchor. For 57 years, this board has been the safety net for Lucas County. So this report is our message to the community that we're not just working to sustain that safety net, but we're working to actively strengthen it to ensure that we can weather what's coming next. There has been a few changes. I'm sure for those of you who have been on the board, I'm sorry, I see you guys flipping through. We do have, okay, sorry. So it is the packet that has a picture of our building on the cover, not the one with the blue bridge. Do you guys have? Um, I'm sorry, I thought it was printed for distribution today. Okay. Senna has one. Did you print that yourself or was it with your stuff? I apologize. Okay. It's a little more robust than the reports we've had in the past. Usually, we might have the basic info on our revenue expenses, basic demographic, people served, maybe a few key highlights. This year, again, to serve as that, the anchor, I wanted people to know that we're actively looking ahead. We're not just responding to the next crisis, but we're preparing for it to help give security and then also the transparency that we deserve. Okay, so in this, and I also would like to say this is the first time we've ever produced this report fully in-house. So I think that helps demonstrate us being good fiscal stewards, but also just helping to connect with the community and having control over our mission and narrative that we present. So as we go on, there's a letter from the director, from Scott, and he talks about what we did over the past year, where we're going in the future. I then highlight the agencies that we partner with, and then I also have staff and trustees, along with our mission, our role, our vision. So as we're going, I've also added other new sections this year to improve public literacy. I've clarified our fiscal cycle versus the calendar, which I think confuses a lot of people not in this room or anywhere. I've also went through and defined some of our budget and financial line items, so we know what that means and where it's going. We don't want to hide in the details. We want to use them to help build public trust, which is so important right now. There's a section with the key highlights when we talk about our strategic oversight, which is the why behind our data. And I really wanted to show that we were about being future ready. So I talk about how we successfully migrated to the Smart Care billing system. Elijah did mention that. I used all of the photos are local, either of the building in downtown, or if it's downtown, we're bigger than Lucas County, but it had our building. And then other pictures in the community to show that where we've been at. So this, and we went a little further this year instead of just the basic demographics of, we were able to go into diagnosis count, money spent per diagnosis, just to really get to see the why of what we're doing and the how. I also, okay, so that's a bigger snapshot of our community. Notes on the data scope, just again to see what it means, if you're not here. After this section, I believe it goes into the finance section. Is that right? Or that's the diagnoses. And so this is our revenue page. Of nearly 40 million in revenue this year, and then it goes deeper into detail of what that means. The local, state funding, federal, and then different breakouts of each of the categories. Okay, and then the next page has our expenses. Again, more detailed information about what those line items actually mean to us and the community. Yes. Okay.
Back into work for the citizens of Lucas County. That's remarkable. I don't know if people are familiar with like the national averages for nonprofits, but that's an incredible.
Wanted to hit on that, but yes, that's something that we can switch around. Yeah.
I'm very proud of us as a board as well as the staff that were able to accomplish that, because that's just telling you how tight we are and how we try to be the best stewards we can be.
And that was really beyond our responsibility to ORC, the goal was we should be proud, and the community should be proud of this institution that we've all worked to build and maintain for them. So yeah, that's great feedback. So that's something I can do. Thank you. So after this, and you can, once you have it, you'll be able to see the different breakdowns that go in. We can go to the next page. Then I hit on our mission and action. You know, we've embedded with 2 local institutions, the Mud Hens and the Toledo Walleye, where they have mental health nights recognition. Their players have done video segments that play during the game that talk about mental health to help address stigma, and encourage people to reach out for help and just to talk. You know, and it's, so if you are into hockey, you know, or even just local news, but the Walleye sellout, they've sold out over 90 games in a row, and they plan on continuing to sell out. So that's at least 8,000 people at every home game that gets to walk by the messaging that we have on different concourse posters. And they even have tablecloths now where the Catrick and Spike, or whoever the mascots are names, they do families autographs that are sponsored by us. So families leave with something that has our information. Were you going to say something, Senna? Sorry.
Great.
Okay.
Just smiling.
So that's, you know, we are where the community is, and that's what I just wanted to show the breadth of our work, and the hope. You know, I wanted to have it bright. I wanted to show that we're not only ready for this. I don't want to say anything beyond that. We're ready. We're ready. All right. So then I talk a little bit about the podcast and how it relates to our mission, and I highlighted a few key episodes. The next one, we go more, it's a lot, our year in review. So I have it broke up into sections. So the first section, strategic investment and operational prudence. And you'll see words like prudence and foresight and stewardship throughout it, because those were the key pillars I really wanted to hit on. So with that strategic oversight, again, that's the why behind our data. This is what, you know, we're getting future ready. The migration to smart care billing. We are translating resource lists into 3 different languages. Those are some other things. Then we also talk about the trainings and community preparedness. The NOVA crisis team, we were able to get people trained. And so now if there is some kind of disaster here, we have a trained team ready to respond. We also had a train the trainer for youth mental health first aid. That means that there's 10 people who can now reach hundreds on their own, going out exponentially with that magnifying force. We, what else? And so that's even beyond the reach of the adult mental health first aid and the CIT that we've been doing. We did, so what else? We have milestones and honors. And again, I know it's a lot of info. And believe me, I tried to get rid of it, but we have so much good stuff to be proud of that I just wanted to really show this. So that's inclusion, community celebration, us in the community. Then it even shows us as leaders in the community. We're presenting at these conferences. We've worked very hard to position ourselves as the behavioral health experts for Lucas County, and I think it's really paying off. They come to us, if they want to quote, people come to us to speak, to do whatever we can, and that's what we're doing. We're embedding into the community. So then I talk about some of our honors, the successful Danny's Place fundraising, the Scott winning a few awards, Phil, other staff winning a few awards. And then I was just nominated and I had a space filler. And then the next page shows some other beautiful photos that we have of just us in the community showing what we do, why we do it, and why the community can trust us and continue to count on us. So this report, I wanted to be a testament to our fiscal integrity and strategic vision. And I wanted to show that we're not just reacting to the present, we're actively engineering the future. And I just hope that this final product really reflects our professional stewardship and what we should be so proud of. So, any questions? Yes.
Did you mention in there the app, the app that we have to sort of drive people to find services? Okay, I just didn't see it.
Okay, I think it might have been on the MUD. I'm not sure what page it was
Never
on.
mind.
Okay.
There we go. Well,
That's the podcast name. But so that doesn't have I don't think it has the app on that page. But I believe it is maybe mentioned in one of the highlights or on the Mud Hens page because that's the info. We have a mural on the main concourse that has the local Help Now information. It actually has a picture of a smartphone with the actual app pulled up. And it says, check in on your mental wellness or check in on your mental health. It was supposed to be a hockey play. Oh, I'm sorry.
Wonderful job, not only all the work, but did a nice job on this. In there, because we went a little, I appreciate you, your efficiency, but do you have a total on all the individuals or, close to it of that you touched, that you trained? Obviously you have the clients, but, reached out to, maybe touched by podcast trainings, et cetera, because I think that would be impactful too if there was.
Absolutely, and that's something we really do want to enhance for next year. I have a number of trainings, I have different things, in any way that I could, I really tried to show that breadth of numbers that we had. Even the numbers served, that's just from our POS system, and I do have a note on the data that says how we collected that. And it is unfortunate because that's such a small portion of what we serve between the schools that we're in. So that is going to be data that we're hoping to better collect in the future, especially with Smart Care, the other improvement that we were able to do. That's going to be one of the benefits of it. Yes, and so unfortunately, for strong numbers, I have the attendance of some of those games or, how many was reached that way, but to really hit the breadth, it's what we're going to be working on to get you better numbers for next year. Mr. Brown?
Goes along with the doctor's comment, because going back to the next.
Mm-hmm.
Versus, and I think that drives home what you were saying is about breaking down all the services and how it impacts. Because if I saw 93 cents, I would say community care. Again, my question would be, how much of that went to direct care?
Yes. And that is something that we're gonna work on to help bring that more inclusive picture. Because in the past, I think we had revenue, 40 million, or in just going up that level and being able to collect that data. And now that we're doing it in-house, that's something that I can build on as the year goes on. And then, as we go, and I'm gonna continue to work with our data staff and program staff to help enhance it. Oh, thank you. All right, thank you, guys.
As myself, I know how hard it is to go from, a very generic to a very detailed. And I just wanna, and I know how many people had to touch this. Faith had a team. And then interrupting their busy schedule to get these kind of details can be quite taxing, because sometimes they're like, oh, really? I have to do this right now? I'm like, oh yeah, this is due.
Because a lot of the data that we get in will be on the calendar year. And so I'm trying to figure out, and I've talked to some of the other communication staff from the other boards about how do we do, how can I report some things on a calendar and then just the fiscal, and so. Mhm.
I only did the financials on the fiscal. I noted based on calendar year, so everybody knew that, because it was so much easier to do that than to try and.
Did really bug for extra numbers to try to go. So, we'll get there. No, thank you. I appreciate it. I'm really proud of it, and it just made me proud to be doing what I'm doing and working here for the county. So, thank you, guys. If the motion is on page 47. Oh,
Okay. Is there a motion to approve? Second?
Second.
Any further questions? Those in favor?
Aye.
Those against? Any abstentions? Motion passes. All righty. Right, the next item we have is our 3-year strategic plan draft from Scott.
Thank you, Faith, and others for putting that together, and special mention to the Wizard of Oz behind the curtain back there.
All right.
Were you going like this every time?
I was like, even when it slowed down, I give a little. So we appreciate that. And we originally thought that we were going to get into our strategic planning around 4:30, 4:45, the way the meeting was flowing. And then we came to a screeching halt. And we got to it at 5:20. So I appreciate Lauren and Katie's patience with us as we work through what we told everyone was gonna be a very packed agenda. But what you have in front of you is the final draft of the strategic plan and executive summary that Lauren and Katie are going to present. They have a slide deck that we will go through that brings us from the point where we last discussed this plan, which was our last P&O meeting, to the plan that you have in front of you. And each of you should actually have both of those documents in front of you for following through. So I'm gonna turn it over to Lauren and Katie, and you guys take it away.
Thank you, Scott, and thank you, members of the board. I want to start first by saying, with these types of strategic planning processes, which can be very participatory in nature and also are meant to lead to concrete actions, it requires a lot of time and attention and focus from staff and leadership alike. And so I think we would be remiss if we didn't also thank everyone at the board and the staff for their time and attention to all of the work that this represents. I will say too, from my experience in having done these in the past, this is a a pretty robust document where we feel as though staff are very well dispositioned towards acting on these strategies with concrete ideas about who will be doing what and when. So our hope is, given all the change in the landscape, which is referenced throughout the larger strategic planning documents, that you all will have good information about what is being done, why it's being done, and doing so in such a way that involves that community voice that really served as the premise for a lot of what you will see represented here today. So we're going to be pretty concise because we gave you a lot of context last time we met in January in terms of what the process led to. And we're really going to show you what evolved from that last committee meeting to today, and then thus this final draft product. So the goal review, I'll start with what we presented on the 6th of January. What you can see here is a collection of really 8 different goal areas. So, you know, what we have highlighted here represented some of the best thinking at the time. And what I will note about this is, you know, some of the feedback we received from all of you was this might be too much. Is there a way that we can, you know, even further hone in on something more concise, more actionable? There were examples, particularly when we think about 1.1 and some of what was highlighted in 5.1 through 5.3, that communication activity should be in a single place because they are codependent. So what we have now represents something a little bit different, right? The initial planning, early in the planning process, the goal structure was intentionally expansive, right? So we have this 8-goal framework that was intended to capture everything we heard through surveys, focus groups, interviews, the board retreat, staff discussions. And at that stage, really the emphasis was on inclusion and completeness rather than a final structure. After we met with you and we progressed in our work with the staff, the plan shifted towards adoption and implementation. And the focus became how to actually function as a governance tool, meaning how to make the strategic plan actually act as a governance tool. So what we did is we consolidated some pieces, and many of the original goals address closely related, like we talked about, or drove the same sort of decisions and accountability structures, particularly around funding, contracting, oversight, and internal operations. So I want to first thank all of you for that insight, because this is something that really was driven by the P&L committee. And then what we decided to do is create these 4 anchor goals. So really these 4 anchor goals represent a deliberate consolidation of those themes. Each anchor goal now bundles related strategies and initiatives, clarifies decision authority, and supports clear sequencing across these different initiatives. Importantly, this change didn't really eliminate any of the priorities raised during the engagement, particularly with the community. Instead, it tries to reorganize them into a structure that's more manageable, more transparent, and better aligned with the board's statutory responsibilities and role as a steward of public resources. So now, what this means too, is that the consolidation positions the plan to move forward effectively from vision to action with clear work plans. We have the RACI documents, matrices that were created with staff. This is an accountability structure to help drive work plans, and then ultimately performance monitoring under each adopted goal. So this is where we landed. You can see this is lifted straight out of the strategic report. I will go section by section, but you get a sort of overall picture here that there are 4 total goals and these different focus areas around, first, organizational development, communication, and accessibility. Second, which really was 2 goal areas, first around priority services and priority populations. The second being around the behavioral health benefit package. Those had a relationship, so we felt like categorizing them together made the most sense, especially in the context of who was providing which work. And then finally, data management and decision support, which has an infrastructure focus, but undergirds a lot of what's being asked of in terms of implementation moving forward. So looking at the first goal, organizational development, communication, and accessibility, the plain language objective is to strengthen how the board functions internally and externally by aligning organizational guidance, decision-making, and communication practices around a shared board-adopted access and action plan that reflects community needs, advances equity, improves understanding and access to behavioral health services, and supports intentional stigma reduction across Lucas County. So the SMART goal statement, which, SMART goal again, smart, measurable, or specific, measurable, so on. Within 18 months, the board of Lucas County will strengthen organizational development, communication, and accessibility by developing and adopting an access and action plan that evolves the board's priority equity and action work, so evolving that work, and serves as a guiding framework for internal decision-making and external communication. Using this framework, the board will establish shared internal guidance to support consistent decisions related to funding, contracting, and access, implement standardized internal reporting to support trustee oversight, and carry out trackable community-facing communication and engagement efforts, including a coordinated stigma reduction campaign that improves awareness, trust, and navigation of board-funded services. These efforts will improve trustee understanding of agency performance and use of public funds, increase public awareness of funded services, and ensure board actions and communications are aligned with documented community needs. You can see here some more of the details around those SMARTY elements: specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. So the idea here, and there's much more detail that's in the deeper report, but just to sort of highlight some of the big pieces here, and this should be goal 1, not point 1, excuse for that typo. Board adopted access and action plan, standardized internal guidance, consistent trustee reporting, coordinated stigma reduction communication. So those are the things that will be produced. How these will be measured will be around the adoption of the plan, standardized report, trustee understanding of performance, volume and reach of public communications. It's achievable because it uses existing reporting processes, financial data, and communication platforms. There's no new staffing or technology required. It's relevant because it uses existing reporting processes, financial data, and communication platforms. Again, no new staffing or technology required. Time-bound, the template should be developed within 3 months, the reporting implemented within 6. The plan adopted and campaign launched within 12 months, and measures stabilized, so some consistent reporting out within 18. And then ultimately communications will reflect diverse providers, trustees, and individuals with lived experience to expand reach and representation countywide. Before I move on to goal 2, I just want to see if there's any questions, or if Scott, you think I should just roll through these and then save the questions for the end.
I'm seeing head shakes of keep rolling.
All right. Goal 2, population support. So this is where we get into 2 different pieces. The first around establishing and aligning priority behavioral health services and priority populations. So the plain language objective here is to clarify and formalize the board's priority behavioral health services and priority populations to guide funding, contracting, oversight, and system development decisions across the county. By November 30th of this year, the board will establish and adopt a defined set of priority behavioral health services and priority populations grounded in data, community need, and statutory responsibility. By February 1st, 2027, the board will complete a review and ranking of all currently funded programs based on alignment with those priorities, and use the framework to inform the fiscal year 28 funding, contracting, and oversight decisions. What that includes: board adopted priority services and populations framework, program alignment review. So there will be a process of making sure that there's alignment in place. We'll know if this is successful if there is an adopted framework, programs were reviewed and ranked, documented use in fiscal year 28 decisions. Achievable because this is supported by statutory authority, existing data, community engagement, and consultant expertise. It's an important piece, especially given the landscape and all of the changes that are coming down that I heard was being discussed earlier. There's going to be a lot that is going to be required to get this underway. So this also helps focus those resources, strengthen accountability, and reinforces the board's system leadership role. The time-boundedness is tied to a framework being adopted in November of this year, alignment review completed in February 27 and applied in the 28 cycle. And then to make sure that this is an inclusive and equitable approach, there's going to be demographic, geographic, utilization, and outcome data used with intentional engagement of underserved and high-need populations to help frame how this particular goal manifests. Moving to the second in population support, establish and adopt a behavioral health benefit.
Can I stop you for a second, Lauren?
Sure.
How much more in detail do the trustees want out of this presentation? Because I'm sensing that you guys have done quite a bit of work on this already. And I'm just wondering if we need the in-depth presentation that you're currently getting.
I don't feel that he needs to read the entire thing.
Maybe the summary, it's on the back
Can
page.
you do a higher level,
Then we can ask questions
Yeah.
from there.
Lauren, you wanna do just a higher level?
Yeah, of course.
Okay.
So going to this sort of framework, there was a lot of discussion, at least at the retreat level, of trying to be concise, trying not to do too much. Also trying to make sure that whatever is in place, that it's measurable and there is some sense of who is responsible for what. And so in summary, these 4 areas really reflect what was gathered not only in the sort of external community facing process captured by focus groups, key informant interviews, and the discussions we had out in the community, but also as a part of the retreat itself and in subsequent workshops that we had with staff. So around goal 1, it's really about a lot of those internal processes. How do you make sure that there's a shared architecture for how the organization operates and communicates out what it's doing? How does it reinforce consistent and standardized decision making? And how does it adopt what was equity in action as a premise or a foundation and evolve it so that it exists across all activities of the board? That second set then around populations is about thinking through what are the implications of the larger environment? How do you prioritize in an environment of increasingly constrained resources, both at the board and then outside of the board, communicate that appropriately and make sure that it's aligned with need and do so in such a way that stays compliant with what's being asked, in terms of regulation, 138, so on and so forth. So that has those 2 components of thinking about prioritizing the services, but also thinking about the benefit package itself and making sure that you're going through what you need to as you think through a pre-authorization or utilization review process. And then the final piece around data management and decision support is ultimately about trying to get into a space of appropriate infrastructure to support all the other work that you're doing. Katie and I are engaged in other projects and other places with similarly situated boards. And what I will say is that data management and decision support are absolutely fundamental to provide you the type of intelligence that you need to operationalize your goals in all of these other places. So we wanted to make sure that we captured that because it's very fundamental when you think about how you establish priority services or prior authorization and combine that with communication. You want data to inform that discussion because to do that is going to be the thing that enables all of your SMARTY goals to actually be SMARTY goals in an effective fashion. And so the larger report contains the process, the detail, some of the feedback. And then finally, the thing I will mention as a part of this is the board has all of the materials through the staff that we created and put together, the raw data from the survey, for example, workshop slides, photos from our retreat process, including some numeracy around what was there. So there's also a strong historical record about what brought us to this point to help reinforce these next steps, because ultimately the staff already have the foundation of a good implementation plan ready to go. So you'll be able to act on these goals quite quickly. So hopefully that's what you're looking for in terms of just a sort of summary review. I'll stop sharing my screen and see if you have any questions.
Any questions?
Can't think of any.
All right, there is a motion. Bottom of page 48.
I so move.
Those in favor? Against? Any abstentions? Motion passes. Thank you.
Yeah, I think it's appropriate to thank both Lauren and Katie for their facilitation of this process. And we appreciate all the work and
Thank you.
flexibility. As I said it in one of our previous calls, we're not the easiest group to work with. We certainly appreciate your flexibility in making the edits and the changes as we move through this process. So thank you very much.
Thank you.
And I want to also recognize Steve for shepherding this process because that wasn't an easy job either. So appreciate that, Stephen.
All right, open session. Open session, any? Richard?
Just learned as I left the government center, there was a very important meeting scheduled for the 19th. This was a public safety committee. They were supposed to discuss the recommendations for extending the shot spotter program and additional recruits for both the Toledo Police and the Toledo Fire Department. It's been canceled and it hasn't been rescheduled, and I'll keep trying to find out more on that. Had a great time this morning at County Commissioners. They recognized Black History Month. This board was well represented. Latrice actually sang the anthem, and Commissioner Sabecki recognized this board. After that, you had the executive director of TARDA. I guess this is Recognized Transit Month or something like that. And she gave a rundown on what TARDA is doing. I do want to say on a personal note, just last Tuesday, as I was getting ready to board a TARDA bus, I heard an elderly gentleman say, and I quote, "They done effed up all these buses." I couldn't have said it better myself. He eloquently, captured the frustration because the elderly are having a hard time with this new schedule. So if you are driving around the TARDA hub, please reduce your speed. You may see elderly people wandering around saying, "Where is my bus?" So after the proclamations were finished, after the festivities was finished, the room empties out like there was a bomb threat. And then the county commissioners get to the meat of the agenda. If I understand this, and I'm not saying that I do, I guess they've signed a new agreement with the 911 Regional Council. It's going to be located in a county-owned building, and I guess county employees will be assisting them, but it's not run by the county. So they have to pay for indirect costs, and it's in quotation marks. Now, maybe I'm just not that smart. When something's in quotation marks, doesn't that mean it's like possibly not true? I don't know. But they have signed the agreement so that they'll be able to provide the necessary funding to the new 911 that they also provided to the old 911. An interesting case is going before the Plan Commission. This will be, it's called Special Use Permit for Community Recreation. This will be described as a community behavioral health center. It is both for adults and children. It will have groups. It will have skills buildings. It will have empowerment, stuff like that. The applicant is Shavella Vonner. The owner is Devontae Williams. If you remember, he's the man that bought the old rescue building, and he was granted in March of last year a special use permit, but nothing ever happened from it. And then in September, I believe it was, he came before City Council asking for a used car lot. Plan Commission approved it. City Council shot it down. I don't know. The Plan Commission staff is recommending approval. I'll keep you updated on that. And how can I not mention that in Sunday's Blade, the big write-up on our agencies in compliance with posting their minutes. I'm glad to say that this board is, but I'm shocked and dismayed to find out that the City of Sylvania Tree Commission is not in compliance. I mean, what is the world coming to? I do, when I see Blade reporters at the meetings, I do give them a hard time. I say things like, "Nice job, guys. That's Pulitzer Prize winning reporting." But I do want to let them know that somebody's reading this stuff. So this board is in compliance. Thank you for listening.
All righty. The additional business, meeting stands adjourned.
Thank you, folks. We said it was gonna be a long one. I appreciate your patience.